Hi, this is Dr. Rob Dowse from Premier Pediatrics, and today I want to talk a little bit about colds with cough and congestion that are associated with it. This is the viral season right now, and it's really hitting pretty good. We're seeing lots of different viruses. Most of them are upper respiratory infections, but we do have lots of variety out there. The thing I wanted to mention, a couple things actually, is that it's very common for our children to get viruses during the winter months. Their exposure is greater because of daycares and because of schools and because of the different preschools and things like this. So they get exposed to lots of different illnesses. In fact, one study shows that out of all the 1 and 2-year-olds in this country, they will average probably about 10 to 12 upper respiratory infections per year for the first 2 years of life. You think about that, that's about 1 every 2 or 3 weeks during the viral season, the winter season. So you can expect your children to get quite a few colds, and that's okay. The majority of them will just have the cough and congestion that goes with it, sometimes a low-grade fever. Once in a while you'll get some of the children swallowing the virus to the point that it'll cause GI upset, which literally means just some diarrhea. And so you'll see a lot of the different signs. Now, how do we treat that? It's really difficult to use anything over the counter because nothing over the counter is really recommended. The CDC and the American Academy of Pediatrics really doesn't recommend using over-the-counter cough medicines for kids. But there are some tried and true, really good things you can do that have been used for decades by good old moms and dads out there, including any kind of Vicks or Vapo rub, mentholatum rub for the kids. You can utilize that on their chest, put maybe a little dab under their nose. Some people advocate putting it on their feet, but I'm not sure if that really works, but it's one of those things you can try. Also, you can do a cool mist humidifier, and you can place it by the bedside during the night. Now, many kids sometimes with a cool mist will cough even worse, and if that's the case, just turn it off and just let it just kind of go on its own. But that's about it. And then for the fevers and for the achiness, of course, Tylenol or Motrin if they're over 6 months of age. So that's really about all we can do for the coughs and colds. If you have a child that's in respiratory distress, and the cough is to the point that they're gagging and they just are really struggling to breathe, then clearly that cold is a harsher one that needs to be seen by us right away or by your primary care physician. So I would just recommend utilizing these steps, recognizing that this is pretty common and it's one of those things that we just have to fight every winter. Okay, thanks.